I presented an update on the Study 19 trial, which was a randomized maintenance trial using Olaparib in women with recurrent high-grade serous ovarian cancer. These are patients who had responded to platinum-based chemotherapy and were then randomized either to Olaparib or placebo. The primary endpoint was progression-free survival, and the data for that has already been presented. What I did at ASCO was present the updated survival with an additional 3 years of follow-up. And what that showed was that there was an improvement in survival in patients taking Olaparib. That was a meaningful survival difference, although it did not achieve statistical significance. And the reason for that was because the trial was not originally designed to show overall survival differences, and also there have been interim analyses which affected the alpha that remained to show significance. But what we did do was to look at some supplementary exploratory endpoints to support the clinical value of that difference. It was a difference of 4.7 months in the median overall survival, which in itself I think is meaningful. But we looked at two other endpoints. One was the time to the first subsequent treatment, that is the time from randomization to the time the next line of chemotherapy was started. And in the women taking Olaparib, there was a 9-month benefit in time to the next line of treatment. And we looked at a second exploratory endpoint called the time to the second subsequent treatment. So after relapse from Olaparib or the placebo, patients had another line of chemotherapy, and at some point they progressed. And that's an important exploratory endpoint. It also approximates to something called the PFS2, which is a co-regulatory endpoint now allowed by the EMA. Because it gives you information about the value of a drug beyond progression. It's quite difficult in trials to show an improvement in overall survival, even if you have a big difference in progression-free survival. So if you can show that the benefit of the drug continues beyond progression, then I think that adds further weight to the clinical value. And again, what we saw in this time to second subsequent therapy was a significant improvement in the patients on Olaparib.